Good afternoon. I'm Dr. Mary Catherine Fisher. I'm here with Daniela, who's my patient today, who's come in to discuss a few things about what she's concerned about on her face. And Daniela, why don't you tell us a little bit about what you're thinking about today?
I like to get rid of any lines around my eye area. So my crow's feet, anything like that. I do tend to have lines that go down a little bit more here, so I'd like to get rid of those. I don't want to see any lines.
Okay, great. Well, one of the things we have available here at the Facial Rejuvenation Center is a product called Botox, and it is a cosmetic use of a product that's been used for years in ophthalmology for medical conditions. But today we're going to use it for her fine lines that she has concerned around her eye bone area here. So what we like to do for patients like this is talk to them a little bit about what the risks and benefits are. And certainly in using a product in medicine, there are always risks. But in Botox, it's been very safe for many, many years. One of the things we are a little concerned about is whether or not patients have been on blood thinners such as aspirin. Have you been on any aspirin or Motrin or any kind of blood thinners?
No.
Good. Generally, I like to have patients be off them for approximately 2 weeks. The risk is, of course, bruising, and of course, in a procedure like this that involves aesthetics, we like to avoid having any bruising. So sometimes I will use ice after the procedure to eliminate that. The only other concerns that we might have with patients are a history of things like Lou Gehrig's disease or neurologic diseases. Have you had any problems with that before?
No.
Great. Well, I think we're ready to go. Okay, well, let's talk exactly where we're going to treat. I always like to discuss with the patient where we're going to treat so that they will know exactly where they're going to have the Botox injected. And I like to have a patient have a mirror in front and they can kind of point out which specific areas you're concerned with. Good. So our plan will be to go right in these little areas here where the fine lines and wrinkles are. And then again, we'll do a little on the other side. I've placed a little numbing cream on because most patients, although the procedure is really painless, the placement of the needle on the skin can be a little bit sensitive. But once the Botox is going in, it really doesn't cause any pain at all. Have you had any Botox before, Daniela?
I have.
And how was that experience?
It was wonderful.
Good.
And you did it, and it was pleasant.
Thank you. Thank you.
I didn't feel a thing.
Good. Well, let's add a little bit more numbing cream. Let's find that. I like to be generous with this. Most patients would rather be completely pain-free. Looks good. On the other side. And we'll let this sit for probably 10 or 15 minutes. Daniel, I have a consent form here. Anytime we do procedures here, I always like patients to understand what those risks and benefits are. So if I could just have you simply sign your name down there after having read that over, which I think you did during that numbing time.
I did. Thank you very much.
In addition, I always have a patient take home a after-treatment card that explains what kinds of things to do at home or not to do, and then I try to provide you with an opportunity to have a phone number in case there's any concerns, and then schedule a follow-up time. Thank you.
Thank you.
So I'll set this down and give this to you at the end.
Perfect.
For most patients, I like to go over exactly where the injections will be, and this I find is quite a nice little visual aid. So I think I will estimate now what numbers of units. In Botox, the bottle contains 100 units, which is quite a lot of Botox. I reconstitute it with a sterile solution. And then I select how many units a patient needs based on how strong the muscles are and how the patient decides how much muscles movement they don't want. You said you want no lines at all.
No lines at all.
So I think we'll plan to do a series of injections here with approximately 2 units for for each muscle group. Good. Now you said you have a little bit more wrinkling on one side.
I do.
Do you tend to sleep on that side?
I do. I tend to sleep on this side, so I do feel that this side does get a little bit more, my Botox, I think a little bit more on this side than I do on this side.
Good. Well, we'll add a couple units on that side and we'll get
Perfect.
it a good result.
Perfect. Wonderful.
We're going to complete our Botox injection on the right side, and we're going to do a little bit less as planned. How are you doing, Daniela?
Fantastic.
Great. Could you smile for me, please? Good. And relax. Excellent. Very nice. We're just doing beautiful. The Botox in the crow's feet goes into a very superficial portion of the muscle. When we use Botox on some of the areas, for instance, between the eyebrows and on the forehead, the muscles tend to be a little bit larger, and so the Botox injection has to be just a small amount deeper, but still requires no discomfort. Daniela, you are just doing beautifully. I don't see any evidence of any bruising. Smile for me one more time. A nice big smile. Good. And relax. And one of the specific areas that Daniela was mentioning was down here on her cheekbone area, the high cheekbone she has. And so we'll make sure we get those particular muscles. Excellent. And you're not having any bruising at all. It just looks great.
Great.
So after surgery, there's, from the standpoint of what kind of restrictions to activities, I tell patients not to take naps on their face for approximately 2 hours. In addition, I tell patients that it's important to move those muscles for the next couple hours, about every 15 minutes. I have the patient go ahead and smile for me. Do that active smile and relax. About every 15 minutes for about 2 hours afterwards. What that does is that takes the Botox material and gets it into the muscles to really get the full relaxation. Okay, Daniela, let me go ahead and sit you up. How are you doing?
Great.
Here's a mirror. I'm going
It's
to let you
over
take
already.
a look.
Oh, very nice.
Excellent. And I'm going to do one more wipe with the alcohol because we did use a needle for these injections. Now, you are welcome to put your makeup on right afterwards. That's not a problem. Many of our patients will bring their makeup with them. Otherwise, we do have a nice selection of makeup here. Daniela is a founder of the About Face Cosmetics, so she's here to help out the patients to cover up any marks from the procedure or to go ahead and blend in with their previous makeup. Well, thank you very much.
Thank you very much.
Sure.
I'm very excited.
And we'll see you back probably in about 3 to 4 months. Generally, the Botox lasts for about 3 or 4 months. At 3 months, you may start to see the muscles start to return their motility. And I usually say come on in 3 months and we'll take a look. If everything's going well, we'll postpone that for another month. Otherwise, we'll go ahead and do a little
Great.
treatment. Thank you.
Well, thank you very much, Dr. Fisher.
Have a good day.
Thank you.